Tonight, a shortage of primary care physicians in Michigan means many may see delayed access to critical care and life-saving diagnoses.
And the problem projected to only get worse. Right now in Michigan, there are nearly 71 physicians per 100,000 people. That breaks down to one physician for every 1,400 people.
But by 2030, Michigan is expected to be short more than 800 primary doctors. 7 Action News reporter Mike Duffy digging into just how big of a problem it is and what needs to be done.
The state is short hundreds of primary care physicians, and this means up to 20% of adults and 8% of kids don't have the first line of defense in their health care. Fortunately, there's a lot the state can do to help fix the problem.
Primary care was such an easy option for me. I was thinking about family medicine very early in my career.
Julie No is a medical student at MSU and will be starting her residency at Henry Ford in July. She loves the diversity of work and importance the position holds in a community.
For example, there was one patient where I was able to suture his stab wound, as well as talking to him about his diabetic medications. And I think that is so cool to be able to do that in one doctor's appointment.
She says she knows primary care is seen as less glamorous and lower paid.
There is that stigma, and unfortunately, especially with Michigan, it may not be as competitive as other states in terms of family medicine salaries.
She believes improving pay would help physician retention and to attract them into underserved communities. But she also has one more suggestion.
Reducing that administrative burden and making it easier for us to focus on the patient itself rather than the paperwork that's involved in terms of dealing with insurances, for example, pharmaceuticals, etc.
I also met up with Dr. Matharu, a family physician in Clarkston. He reacted to the shortage.
It's troubling. It's concerning for the future.
He says he got into family medicine because it's very rewarding to him.
It's not just all about money, but more support needs to be given to primary care so that they don't feel that their efforts and their work is underappreciated.
He agreed with Julie No, telling me administrative work has become an increasing burden over the years, taking time away from patients.
We should have some type of plan or mechanism to retain these people.
Julie Phillips is a family doctor and the chair of family medicine at MSU's College of Human Medicine. She explained the magnitude of the state's problem.
We're projected to be short more than 800 physicians, primary care physicians by 2030.
She emphasized that primary care keeps people out of the emergency room.
We help prevent disease and we also help save money. You know, there are not many things in the world that actually have a positive impact and also help save money at the same time. So primary care doctors are pretty magical and pretty important in that way.
Michigan has 2 programs to incentivize med students to get into primary care. The first is called MyDocs, which supplements residency programs so that they have the funds they need to educate primary care doctors. The other is the Michigan State Loan Repayment Program, which pays back or forgives up to $300,000 of a med student's loans. However,
about half the people who qualify and apply for the Michigan Loan Repayment Program don't get the funds. One thing we could do would be to invest in that program more substantially as a state, and that would really make a big difference.
In Clarkston, Mike Duffy, 7 Action News.